to be covered.
Well, I agree very much with everything that you've said, and I particularly want to thank you for the stories of individuals, because it's individuals that the Affordable Health Care Act was meant to cover. Not groups of people, but Americans, everyday Americans, children, disabled, our elderly. You know, some of the reports say that Trump Care would be the largest transfer of wealth from working families to the rich in our nation's history, that the Republicans are handing $600 billion in tax breaks to rich and big corporations through this bill, while taking money away from those Americans who have been able to have their health care needs taken care of in an affordable manner. You have families that are going to be paying more for less under Trump Care. Deductibles and out-of-pocket costs are going to skyrocket, leaving 6 people unable to afford the care that they need. Premiums soar, quality coverage is going to be priced out of reach for many families. We also heard earlier about the middle-aged Americans pay age tax that's going to come from this, that older Americans are going to be forced to pay premiums 5 times higher than what others pay for health care coverage. Senior citizens will really take a major hit if this law is passed. And our colleagues have been giving us examples all the time. You know, I'm always trying to let them know that the Virgin Islands stands as an example of what it will look like if the Affordable Care Act is repealed. Because the Virgin Islands doesn't have the expansion, we were not put in the mandate for the exchange, and that has led to 30% of Virgin Islanders having absolutely no health insurance, which then means that our hospitals are strained because the hospitals have to pick up costs for individuals who are without health care. And listen, if your child is ill or sick or you are dying, you're going to go to the hospital, whether you can take care of it or not, whether you can pay the bill or not. And that's put a tremendous burden in our hospitals for them to meet the costs of those 30% of individuals living in the Virgin Islands who do not have health insurance, are not covered by either the government group insurance for the local government or by the Medicaid money that we utilize because we did not have the expansion. And even that is scheduled to leave after the fiscal year 2019. And we're going to have to make choices of removing people from Medicaid, of removing care from children, removing care from elderly and from individuals with disabilities. That's not a choice that Americans should have to make in this day and age, that individuals do not receive health care. And I know, Congressman Vesey, that you are hearing from people in your own district who are giving you these same stories about what's going to happen if I don't have health care coverage. What's going to happen to my children if they're not able, they have asthma, they have juvenile diabetes, they have these issues, and I'm not going to be able to take care of them because I'm not going to have this insurance. Or the Medicaid is going to have to be pulled back in our state because we're going to have it capped, and our state is not a wealthy state and is not going to be able to make up the difference. And I know that you have examples from other members who've come to and given statements for us to bring to the record about what's going to happen.
Yeah, no, absolutely, Representative Plaskett.
From our experience in the Virgin Islands, that's what you do not want to happen. You know, people talk about who's on Medicaid, who are these types of individuals, why don't they get jobs? I mean, in the Virgin Islands, when we had our largest employer, Hovensa oil refinery, close, of course, then our unemployment rate went up. And these are families in need, families who need the support. And with a cap on Medicaid, we were only able to have 55% of individuals who would qualify for Medicaid with that cap, with that ceiling that was in place from the federal government. And it means that a tremendous amount of children, homeless individuals, people, families that are out of work for a period of time are not covered. And that then creates this huge burden on a hospital for those families to be taken care of, for individual care and individual need. And particularly in the African American community, when you have things like diabetes, hypertension, all of these diseases which need constant monitoring and primary care physicians to take care of to ensure that they do not become life-threatening and come to a place where then they are coming to the hospital and it's in the millions of dollars that you're going to need support and care for the servicing of individuals with these diseases. So I know that we are pushing that there be an expansion of Medicaid, that the cap not be put on Medicaid services, not because we want to coddle people who are poor, but because we know it's necessary. And the cost of not taking care of them on the front end of health care with Medicaid is an astronomical cost on the back end when they have diseases that have just gone out of control because they have not been able to go and take care of primary care physicians and the health care needs that they need. Thank you for all of the examples that you've given. Real world, real people examples. And I think it's important that all of us as members of Congress really take to heart the words that we're hearing from Americans that are going to be affected by this, particularly in the African American community. This is going to be a devastating effect on them to have this Affordable Care Act to be repealed and this replacement. It does not take into account the lives that people are really living. This is really a tax break bill. That's what this boils down to in many respects, because the individuals who are going to be displaced from this are those individuals who are the poor. And I just want to thank you, Congressman Vesey, for the time that you've given us this evening, and all of our colleagues who were here and spoke about the Affordable Care Act and what the African American community and what many Americans have to lose from this bill. And so